Hello. In this video, I will be discussing the experiment chemical aversion treatment of alcoholism using lithium as the aversive agent. This experiment was conducted by Voegtlin, Clive Mellor and Sam Revusky in 1974. Chemical aversion therapy was quite a popular way of attempting to combat alcoholism in the late 20th century. Much of the research was done on animals, as this type of therapy involves giving people severe sickness. Many people believe that this therapy is unethical, as forcing someone to be sick is inhumane. This means that experiments with humans are very rare. Therefore, the main reason I chose this experiment was because it was one of the few that used humans as the subjects. I thought this was very important because alcoholism is a problem in humans. Therefore, to get the most accurate results, humans should be used as the subjects. Okay, so what is chemical aversion treatment? Basically, it is a treatment used to try and make people hate the taste of a certain flavour by making them really sick after consuming a particular food or drink. In this case, this treatment is being used to try and combat alcoholism by using lithium to create the sickness. The way it is done is by allowing the subject to drink some alcohol and then straight after getting them to take a lithium carbonate capsule which causes them to be really sick. This makes them relate sickness to alcohol, causing them to not want to drink the flavour or taste alcohol again, as it brings on feelings of sickness. Okay, so what was the reason for this experiment? The reason this experiment was conducted in the first place was to test the current findings on animals, in animals on humans. Many experiments have been done in order to test whether chemical aversions therapy could create aversions to certain flavours in rats or animals like rats, but not much had been done on humans. In one of the other experiments I summarised, Elkins managed to create aversions to tap water in rats. These type of findings show that if multiple conditioning is applied, strong aversions can be made to a certain flavour, therefore giving other psychologists such as Voegtlin, Mellor and Revusky enough evidence to test these findings on humans. Okay, so what was the aim for this experiment? The aim of this experiment was to create aversions to alcohol by using lithium as the aversive agent. Due to many animal experiments carried out, they hypothesized that aversions would be made. Okay, so who were the participants? So, the participants were 25 males who had been admitted to General Hospital Psychiatric Unit. The criteria they had to fulfill was: 1. They had to be aged between 25 and 55. 2. They had to show an addiction to alcohol. 3. They have to have abstinence as a goal. 4. They were not allowed to be on any other medication when the experiment started. And 5, they all had to understand the procedure. They also had to have a control group who also, They also had to have a control group who also fulfilled this criteria. This control group was used to create a comparison between two drugs so that the effectiveness of lithium could be measured. Okay, so what task were the subjects presented with? Okay, so in order to create the aversion, the subjects were put into rooms of 2 or 3 people. They were given a particular drink, so such as like beer or spirits or wine, so they were given that drink. They were told to swash it around in their mouth and then spit it out. They were then given a lithium carbonate capsule and told to swallow them and use the rest of their drink to wash it down. After this, the subjects were told to taste, smell, and sometimes drink the alcohol. This persisted for 15 minutes or until they began to feel sick or started vomiting. This process was repeated for 6 sessions, which were spaced 2 days apart. Each session, the amount of lithium carbonate increased by 300 milligrams per session. As the experiment went on, it was clear that some of the subjects reacted more to lithium than others, so basically they got more sick than others. This related back to the other experiment I summarised, as Elkins found that genetics plays a huge part in the success of aversion therapy. Therefore, some of the subjects may never react to the aversion therapy due to their genetics. In order for the psychologists to see if lithium is an effective aversive agent, they had to have a control group. This group was to follow the same procedure, however, instead they took citrated calcium carbamide as their chemical. It would have been more scientific to try and create the placebo effect on the control group. However, this is not a practical way of creating aversions, as no sickness occurs. Okay, so what were the key results? Okay, so during the aversion phase, the results showed fairly intense sickness. 65.7% of the reactions had an intensity of 2 or 3, which meant that the patients were complaining of severe discomfort, had gaseous abdominal cramps, heaving as if to vomit, mild headaches, and vomiting. These symptoms meant that the reaction could be considered successful, so aversions were made from these reactions. The 6-month outcomes showed that 36% of the subjects were abstinent after 6 months. This was significantly higher than the 12% that used the citrated calcium carbamide. However, if we exclude the patients that did not react to the aversion treatment, the abstinent rate increases to 47% after 6 months, giving a better result. This gives a better result and takes away the genetics aspect, making the results more accurate. Okay, so what did the researcher conclude from these results? The researcher concluded that using lithium as the aversive agent is better at creating aversions than citrated calcium carbamide. However, the results in this experiment were much lower than some of the results that had been found in similar experiments before this experiment. The researchers concluded that this could be due to the type of people who were used for this experiment. The people who were involved in this experiment were from a lower subpopulation than some of the other experiments that were previously performed. In a similar experiment conducted by Lemere and Voegtlin in 1950, found that aversion treatment suited better circumstanced people. This is because they are willing to undergo the treatment and pay a substantial fee to have it done, whereas the subjects in this experiment had pretty unfortunate circumstances before coming into the experiment, therefore hindering their drive to combat alcoholism. Okay, so were there any limitations in the methodology? So, one of the limitations in this experiment was that the control group and the experimental group scientifically differed. This is because the length of stay for the treatment group was 6 days longer than that of the control group, due to a longer initiation period. It is unlikely that this made a huge difference to the results. However, if this experiment was performed again, it would be better if the process for both groups incorporated exactly the same procedure. Also, the average age of the groups differed, as the treatment group had an average of 5 years younger than the control group. This could have upset the results, as we don't know if age has an effect on a person's ability to create versions to certain flavours. Okay, so therefore I believe this experiment was very relevant to the topic of taste aversions to alcoholism producing behavioural change, as they used humans as the subjects. They also managed to create aversions for some of the subjects, however not all. Although the results did not show aversion therapy using lithium as the aversive agent is a great way of combating alcoholism, this experiment provides a lot of insight into how humans react to aversion therapy. This experiment provides a great basis for further research surrounding whether taste aversions should be used to combat alcoholism. Thank you.